What is rectal bleeding? Rectal bleeding refers to any blood that passes from the anus, although it most commonly indicates bleeding from the lower colon or rectum. You may notice bright red blood on toilet paper, blood in the toilet bowl, blood mixed with or coating the stool. The color of the blood provides important clues. Bright red blood usually comes from the rectum or anus. Dark red or maroon blood may suggest bleeding from the colon or small intestine. Common causes of rectal bleeding. 1. Minor causes. Anal fissure, a small tear in the anal lining, often caused by constipation or passing hard stools. Symptoms: sharp pain with bowel movement plus bright red blood hemorrhoids. Swollen veins in the anus or rectum can be internal or external. Symptoms: itching, pain. Blood during or after bowel movement, constipation, and hard stool. Straining during bowel movements may lead to bleeding or fissures too. Serious causes that require medical attention. Colorectal cancer, a serious condition that may cause unexplained bleeding. Warning signs: persistent bleeding, weight loss, bowel habit changes, colon polyps. Small growths that may bleed and can become cancerous over time. Inflammatory bowel disease includes Crohn's disease and ulcerative colitis causes. Chronic inflammation and ulceration in the digestive tract. Ischemic colitis caused by reduced blood flow to the colon. Common in older adults. Infections or radiation therapy. Bacterial infections like C. difficile. Radiation for pelvic cancers may inflame rectal tissue. Symptoms of rectal bleeding, aside from seeing blood, you may notice pain during bowel movements, abdominal cramping, change in stool color or consistency, dizziness or fainting, mucus in stool, unexplained fatigue. When to seek emergency help. Call emergency services or go to the ER immediately if you have heavy or persistent bleeding, fainting or feeling dizzy, rapid heartbeat or weak pulse, pale, clammy skin, nausea, or confusion, reduced urine output. These signs may indicate hypovolemic shock, a life-threatening condition due to blood loss. When to see a doctor, schedule a medical appointment if bleeding lasts longer than 2 days. Blood appears repeatedly. You have severe abdominal pain. You have a personal or family history of colorectal cancer. Even if the bleeding seems minor, don't ignore it. Tick could be an early warning sign. How is it diagnosed? Doctors use several tools to determine the cause: physical and rectal exam, blood tests, colonoscopy, CT scan, or MRI, stool tests. Treatment options. Treatment depends on the underlying cause. For mild causes, topical creams or suppositories for hemorrhoids, stool softeners, or fiber for constipation, antibiotics. If infection is the cause, it's for serious causes. Surgery to remove polyps or cancer. Immune-suppressing medications for IBD, radiation, or chemotherapy for cancer. Self-care and prevention tips: eat a high-fiber diet to prevent constipation, drink plenty of fluids, avoid prolonged sitting on the toilet, exercise regularly. Note: delay medical checkups if symptoms persist.